Today we're going to talk about something a lot of dog owners face as their buddies get older: Cushing's disease. We're going to break down what it is, what signs to look for, and the really hopeful news about how it's managed.
You know, it's a question we all ask ourselves. Your dog starts to slow down a bit. Their habits change, and it's easy to think, well, they're just getting older. And sometimes that's all it is. But other times, those little changes are clues pointing to something else entirely.
Maybe you've noticed you're filling up the water bowl way more often, or your perfectly house-trained dog is suddenly having accidents overnight. While things like this can definitely be part of aging, they can also be the first signs of a very manageable condition, which is what we're here to talk about.
All right, so let's get into it. What in the world is Cushing's disease? The easiest way to wrap your head around it is to think of your dog's body as this amazing little hormone factory.
The fancy medical name is Hyperadrenocorticism. Yeah, let's just stick with Cushing's. At its heart, it just means the body is making way too much of a hormone called cortisol. Now, cortisol itself isn't a bad guy. It's the body's natural stress hormone, and it's super important. The problem with Cushing's is when that production switch gets stuck in the on position.
So here's how that factory is supposed to run. You've got the manager. That's the pituitary gland in the brain. It sends out an order. The workers, the adrenal glands by the kidneys, get that order, and they make the product, which is cortisol. Simple, right? But with Cushing's, there's usually a tiny, benign tumor on the manager's desk, causing it to just scream orders all day long. So the factory goes into frantic overtime, and the body gets flooded with way more cortisol than it needs.
So who's most likely to get this? Does it affect certain dogs more than others? Let's take a quick look at who's most at risk.
Well, when we look at the causes, it's actually pretty clear-cut. For the vast majority of dogs, about 85% of them, the issue is that little tumor on the pituitary gland, our overenthusiastic factory manager. In the other 15% of cases, the problem is a tumor on one of the adrenal glands, the workers themselves.
Typically, we see Cushing's pop up in middle-aged, older dogs, usually somewhere between 7 and 12 years old. And while any dog can get it, we do see it more often in certain breeds, like Poodles, Dachshunds, Boxers, and Yorkies. The less common type, the adrenal tumor, tends to show up a bit more in larger breed dogs.
Okay, now for what I think is the most important part of our chat today. What are the signs you can actually spot at home?
And I really can't stress this enough. You know your dog better than anyone. You see the little things, the subtle shifts in their day-to-day, your gut feeling that something's just a little off. That is the most powerful tool we have. It's always the most important first step.
So what does all that extra cortisol actually do to the body? Well, it makes them incredibly thirsty, so they drink a ton, which means they have to urinate a ton. It can also make them feel starving all the time. You might notice a bit of a pot-belly developing. That's because the excess cortisol weakens the abdominal muscles and things start to sag. Panting, even when they're just resting, is another big one, along with hair loss and skin that just seems fragile or gets infected easily.
Okay, so you've noticed a few of these things, you've made the call to your vet. What happens next? Let's walk through what the visit looks like so it's not so mysterious.
It's a pretty straightforward process, really. We'll start with a good physical exam and, most importantly, we're going to listen to you. We want to hear every little thing you've noticed. From there, we'll probably run some basic blood and urine tests. If those point us in the right direction, we move on to some very specific hormone tests to get our definitive answer. You might wonder, why can't you just test their cortisol level? It's a great question. The reason is that cortisol levels bounce up and down all day long, even in a perfectly healthy dog. So to get a real answer, we have to do these dynamic tests. They let us see how the whole hormone factory is actually working, or not working. We're basically testing to see if the gas pedal is stuck on and if the brakes are broken. Getting a diagnosis like this can feel pretty heavy. I get it. But I really want to talk about the good news now, because this is a condition where we can make a huge difference and bring back that amazing quality of life for your dog. And honestly, this quote says it all. The reality for dogs with Cushing's today is so positive. With the right treatment, most dogs do incredibly well. They get back to just being dogs, living a normal, happy life. And our goals for treatment are really simple. We just want to undo all those symptoms. We want to stop the constant thirst and potty breaks. We want their appetite to go back to normal. We want to see their energy come back, their coat grow in healthy and lush. Really, it's all about giving them back their comfort and happiness. For most dogs, the best path forward is a daily medication. It works by gently tapping the brakes on that out-of-control cortisol production.
It's something they'll need for life, and it does require regular checkups to make sure the dose is just right, but it is so effective. For those less common adrenal tumors, surgery can sometimes be an option to remove the problem entirely.
So if you take away just one thing today, please let it be this. Cushing's isn't a scary endpoint. It's just a condition that needs to be managed. A diagnosis is the first step on a path to helping your dog feel fantastic again. And that's a really hopeful thing.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.